Good evening. We are live at 7 o'clock. I'm Stone Grissom, and welcome to our live coronavirus pandemic special report. Tonight, we have with us Nassau's Health Commissioner to help you navigate what's going on with COVID-19 in our communities and, of course, across the region. And we want to hear from you. So call us at the number at the bottom of your screen, 516-393-1800. All right, Governor Cuomo today is giving a pretty distressing warning. He says the rate of coronavirus cases and rate of new infections in the state is doubling about every 3 days. You see the numbers right there. Cuomo says the curve is heightening, not flattening, with more than 25,000 confirmed cases in the state. Today, county executives Curran and Malone announced combined on Long Island, we now have more than 4,700 just confirmed cases. Those are just the ones we know about. Statewide, 210 people have already lost their lives from this deadly virus. The governor also saying we have a critical need for ventilators. We need an additional 30,000, and he's calling on the federal government to release its stockpile to New York and to use the Defense Production Act to get private manufacturers to be forcing them to build more. Coronavirus drug trials start today in New York. State health officials will begin testing an experimental treatment with a malaria drug and an antibiotic. It's commonly known as Z-Pak. Health officials will also try a treatment that involves taking plasma from someone who's infected with the virus, processing that, then injecting the antibodies into the sick individual to stimulate the immune system, or that's the hope at least. Nassau County Executive Laura Kern working to evaluate the economic impact the virus is having here on the island. Nassau and Hofstra University have created a new advisory council. Curran says the data-driven initiative will help officials assess what needs to be done for financial rescue and recovery. And the president hoping the country will be open before Easter. That's about 19 days away. Soon get back to normal, while at the same time his own medical experts are calling for more restrictions on public interactions to slow the spread of the virus. A lot of information to digest. Joining us now, let's start our discussion. Nassau Health Commissioner Dr. Lawrence Eisenstein. Thank you again. I know it's busy for all of you right now. Let me start with the the alarming numbers from the governor. He's saying that we're short on beds, on hospital beds, ICU beds, 40,000 that we need, 140,000 regular beds, that we need 30,000 ventilators. How is the county faring right now as far as its supplies?
Thank you for having me, Stone. I think it's really important that from the very beginning we've been saying we hope for the best but prepare for the worst. And when we're looking at models of a new respiratory virus, we don't know the exact rate of transmission. We don't know just how contagious a virus is. And we've been saying all along we're going to be learning a lot about it day by day. And we have had a lot of new cases. We've also been testing more people in New York than anybody else, and especially down here in the metropolitan area. So we're not surprised to see many more cases coming in very quickly. Through our Emergency Operations Center, we're in communication with our hospitals in Nassau County. We're keeping track to make sure that we have ventilator capacity and critical care bed capacity. All of those items are only helpful if we have medical staff ready and able to take care of patients in those beds. As of today, I'm happy to say we do currently have capacity, but as case loads go up, we're going to be watching it very closely and working with our partners at the state and federal government should we need more resources.
All right, Dr. Eisenstein, I have a lot of questions. I don't want to monopolize your time, though, because I know the viewers, they have a harder time talking to you directly. So let's get right to the phone lines right now. Rosanna from Long Beach.
Sure.
Rosanna, you there?
Hi, yes. Hi. How are you?
I'm doing great. What's your question tonight?
Good evening.
My question is, as the weather is getting nicer, what's the effect of weather, like such as, heat or cold or rain or snow on the coronavirus?
So that's an important question that we've been asked many times, and I know we're used to cold and flu season being a winter type thing. But the truth is, this is a new virus, and we're not exactly sure what's going to happen when the weather warms up. There have been some reports, although they're not evidence-based, and certainly the sample size is small, that show that humidity and heat is helpful in preventing the spread of virus. But we don't know that for sure, and I don't think I would be comfortable at all making any prediction about how the change from winter now to spring and into summer is going to impact future transmission of the virus. I'm sorry, we just don't know the answer yet.
Yeah, Dr. Eisenstein, let me follow up on that because, and this may be a naive question coming from a layperson like myself, I see the spread of this virus hitting areas that are already really warm. South America, Africa, Australia. I mean, these are areas, Hawaii has cases. I mean, these are areas that just don't get cold naturally. Does that play into this at all?
Well, we really don't know, Stone, and the fact is that with travel today, people can be very contagious, and in one part of the world in the morning and a different part in the evening, and just it could be exposure from prior travel that does it. So I don't think we can draw any conclusions, but we'll be watching it very closely. We are hopeful with other coronaviruses, with flu viruses, there does tend to be a seasonality where the summer provides relief. The other side of that is, if that's the case, we also have to be prepared for a potential resurgence after the warm summer passes. So there's a lot of factors that we're considering, but for right now, I don't think anybody would be comfortable in the infectious disease world making a clear prediction on how upcoming warmer weather will impact future transmission of coronavirus.
All right, let's go back to the phone lines. Robert from North Quorum. Robert, you there?
Hey, my name is Rob.
Rob?
I have I'm sorry. A little verklempt here. I have nieces and granddaughters who are pregnant. They work in the medical field. What should they do? First trimester, second trimester? Are they safe? Are they not safe?
Okay, Dr. Eisenstein, they're pregnant and in the medical field.
Yes, and so as it is a new virus, we don't know the impact long-term on pregnancy. I will tell you that tomorrow we'll be announcing Northwell Health System is launching a pregnancy hotline, and we're going to announce it tomorrow at a big news conference at 12 o'clock where anybody who's pregnant that has a question will be able to call up. We're very excited to have that kind of partnership. It's great being the health commissioner in a county that has such world-class healthcare infrastructure, and certainly nothing is better for medical questions for a woman who's pregnant than to reach out to their own obstetrician. Every case has unique circumstances, and their obstetrician's the person that will know a pregnant woman better than anybody, and so there's no advice I can give that would be better than somebody's own doctor giving them advice.
Okay, back to the phone lines. Tom from Islip.
Yet.
Oh, thank you very much. I hope that helps, Rob. Tom from Islip. Tom, you there?
Yes, I'm right here.
Okay.
Doctor, how effective are the Purell-type hand sanitizers against the coronavirus?
We think they're very, very effective, and the fact is that hand hygiene, nothing beats soap and water, good old washing your hands, but very often wherever we are out and about, there might not be a sink right there, and so we know that hand sanitizers typically with at least, people have asked if one brand is better than another, typically we're looking for a 60% alcohol content, and it's the rubbing that really helps to kill the virus on top of the alcohol drying off. As you rub your hands with hand sanitizer, it's important that the sanitizer dries from your hands. It's the drying and the rubbing impact that causes virus to be destroyed. And in lieu of soap and water, which will always be the first option, hand sanitizers are a good secondary option. And I keep telling people, I've been asked a lot, does the virus live on surfaces or door handles or elevator buttons? We're still learning that. We're seeing that the virus can live for a certain amount of time outside of the body. We don't know if that means it's transmissible. But the fact is, if you touch a door handle or an elevator button or a railing or whatever it is and get the virus on your hand, you're not infected yet. You still have an opportunity to wash that virus off your hand or use a sanitizer to destroy it off your hands and prevent yourself from getting sick. So I appreciate the question. It's a really important question. And when there isn't soap and water available, if possible, people should use hand sanitizers, especially after they've touched common surfaces. They should especially wash their hands before they're going to eat. And we've been telling everybody, try not to touch your face. If you can, wash your hands. Use a hand sanitizer as well. Will prevent that virus from going from your fingers into a place where it can infect you.
Yeah, and if you use a pen, like I do every day, make sure you sanitize. I can't tell you how clean this pen is at this point.
Sure.
All right, let's go back to the phone lines. Chris from West Islip. Chris, you there?
Yes, I am. Hi, good evening.
Good evening.
I heard that a possible treatment has been approved combining the drug from malaria and Zithromax. Zithromax Z-Pak is an antibiotic used for bacterial, not viral. Why are they using it?
It's a good question. I know we're starting trials right now.
So that's a really...
Yeah. Go ahead, doctor.
Yeah, so I want to be clear. Those drugs are not approved. What is approved is clinical trials to see if they work. And the mechanism of actions of various chemicals in a laboratory have shown that there are antibiotics which typically do work against bacteria. The caller's right. Azithromycin is an antibiotic that's usually antibacterial. But we are seeing with the chloroquine, the hydroxychloroquine, that there can be antiviral action. But I want to be very clear. They're not approved yet. What is approved is clinical trials, which started today. And as Dr. Fauci, the nation's leading infectious disease doctor, said on his interview just before this, the fact that we have so many cases is going to allow us to get the clinical trials done in a more expedited fashion. So those drugs are being tried because in laboratories, on Petri dishes and in other models, they've been shown to kill the virus. We're hopeful that we're able to translate that into killing the virus in human beings, but I do caution, not everything that works in a laboratory works in real life, and so that's why we're doing clinical trials. We have a reason to be hopeful. It is not a surefire thing that's going to be a miracle drug. Also, we've heard that doctors have started writing prescriptions for some of these medications, and pharmacies are running out of them. All antibiotics, and particularly chloroquine, can have side effects. They can be dangerous. We don't want people hoarding antibiotics. They're not approved. They're approved for the reasons that they're approved for. Malaria and a couple of rheumatologic conditions would be hydroxychloroquine. Azithromycin is an antibiotic used in certain infections, and there are approvals for that. But other than that, we hope people will not seek out these medications and store them just in case. All antibiotics can be toxic when not used correctly. Before a drug gets approved, part of the clinical trial is not only that it works, it has to be shown that it works, but also that it's safe. And we know chloroquine, hydroxychloroquine can cause heart arrhythmias, it can cause anemia. There are side effects, and so these medications should only be used under the guidance of a physician and with a full understanding of the medical history that somebody who's using it has, because people with underlying heart disease are going to be at higher risk for a heart arrhythmia if they use these medications. So there are other things that are in the pipeline. It's exciting that science is working at an incredible speed. Finding a way to cure coronavirus is something that will certainly bring a lot of relief to us in public health and medical community for all of our residents who are, quite frankly, fearful. Yes, Stone, sorry.
We just need to take a real quick break. I'm going to let you finish your thought right after this commercial break. We're going to be right back. More advice, keep you and your family safe from the coronavirus. We want to hear from you. 516-393-1800. We'll be right back. Welcome back to our live coronavirus pandemic special report. Remember, we want to hear from you. Call us now with your questions, 516-393-1800. Let's bring back in our expert, Nassau County Health Commissioner, Dr. Eisenstein. Now, before the break, you were giving us an idea of the clinical trials that are going on. Do you have any idea how long you anticipate these trials will last before we might see something come to market?
I don't know how long it will last. These drugs certainly are already marketed, so if we find the one good thing, if there is a silver lining about having so many cases, is that we should be able to get large amounts of data relatively quickly. And with all clinical trials, if there's a result that's so overwhelmingly clear, it could certainly expedite the process. So I think there is reason to be hopeful, but by no means is this a sure thing. And I think it goes back to the beginning, prepare for the worst, but hope for the best.
Okay, let's go back to our phone lines. Mark from Islip. Mark?
Hi. First, I'd like to thank everybody involved for having this kind of an informational show. Me and many others think that they're great. My question is this. In this age of social distancing, why aren't we hearing any of our governmental representatives encouraging people to wear surgical masks if they have them when they do have to go out? We look at TV, we see that happening around the world. But if we had that in the United States, wouldn't that also help stop the spread of the virus?
Doctor?
So thank you for the really important question. Actually, the CDC has not indicated surgical masks for people who are not sick. And the fact is that for surgical masks to work, they don't cover all of the membranes where a virus can infect you. The masks are indicated for people who are confirmed to have disease to catch any respiratory droplets that they're breathing out. But currently, it's not an indication of the CDC, and it could provide a false sense of protection that's not true. We have to make sure that the respiratory mask supply is available for our healthcare providers and our first responders. You've heard a lot about that. We've worked with the state and federal government to make sure that our healthcare providers have the protection that they need. And so the answer is no. We do not recommend that the average person who's not sick wears a mask when they go out and about. That is not proven to be effective in this case. But it is indicated if somebody is confirmed with coronavirus and they need to be transported somewhere, we would ask them to put a mask on. But that should be a very quick, very short transport.
Okay. Steve from Oceanside. Steve? Steve, you there?
Yes, can you hear me?
I can hear you. What's your question?
Okay, great. My question is in regards to like fresh fruit, like apples, for an example, being handled in the store. How do you go about cleaning them or eating them, or what do you suggest? Something like that.
So I would give the same advice even before coronavirus. The fact is, fruits and vegetables should be washed before you consume them. You don't know there are many other bacteria and viruses which can cause disease. So whether it's coronavirus or E. coli or hepatitis or anything else that could have been in the community that came in contact with that fruit, all fruits and vegetables should be washed, especially those where you're eating the peel. And a good washing of a fruit or vegetable it's very unlikely to transmit coronavirus through fruits and vegetables in the first place. Coronavirus does not do well outside of the human cells for a long time. Very often those fruits have been there. I understand that especially when it comes to apples, people will pick through them and touch many of them. But there are many other viruses and bacteria that you need to protect against. So please wash your produce and you'll be fine.
Yeah, great advice. Andrea from Long Beach. Andrea?
Hi, Dr. Eisenstein. My question is, I've been in isolation for 9 days now, and I went today to the doctor because I got back from Europe last week, and I haven't been feeling well. They did give me the corona test. They said it was going to take 48 hours. Now, if I do come back positive, do I have to start over again and do another 14 days in isolation?
So isolation there's criteria for it. It's a really important question. So the first 14-day isolation you were in was because of the risk of you developing it. And the key to breaking this whole chain is that when people are sick, if they become sick, we need them to be isolated. So the 14 days that you're on now is before you got sick. Now that you've had symptoms, if you do become sick, a new protocol would begin. It is not a 14-day protocol per se, but the latest, there's a couple of protocols out there. What it would be is it would reset the time. You'd be looking at least a week from the day that you became sick, plus 3 days of no symptoms. So it's actually possible that if you are sick, you're freed from quarantine sooner than if you've just been exposed to somebody who's sick, which is a full 14 days. So even though they're both quarantined, the purpose and the risk are different. So to answer your question, if you are positive, yes, you would start a new quarantine protocol, but no, it would not necessarily have to be 14 days. If you stayed sick for a longer time, it could be longer than that, though. We have had people who've had this virus that have been sick for a couple of weeks solid, and so you're going to need 3 full days of being fully well before you'd be released from quarantine.
Well, Dr. Eisenstein, we want to thank you very much for taking the time. I know you're very, very busy. I want to thank you also for all of your hard work that you do out there. Any updates, if you'll just contact us, we'll make sure that we get this out to the public. I want to thank again Dr. Lawrence Eisenstein, the Nassau County Health Commissioner, and I also want to thank you, the viewers, and thank you for all of your questions. Keep them coming. 516-393-1800. I'm going to be right here back tomorrow night at 7 o'clock taking more of your questions. Thank you. See you then.